Hi, my name's Lily and I'm one of the physical therapists here at Breathe. And so today I'm going to tell you guys a little bit about myself and mostly about who we are as a clinic. And then also I'm going to tell you about some tips for health and postpartum, and then some exercises that are specific to women and especially in a postpartum population. And we'll also talk about the pelvic floor. So I have our friend, the pelvis, with me, and we'll be talking about that. So this clinic is called Breathe, and we have two locations. One is in West Des Moines, off of 50th and I-235, and then our other clinic is in Beaverdale. And there's 7 of us therapists here, and we specialize in women's health, but also outpatient orthopedics. So outpatient orthopedics is things that you think of like, your knee hurts or you have low back pain, or maybe you're getting headaches or neck pain. We do a lot of that. But with the scope of women's health, we deal with issues relating to the pelvic floor. So peeing your pants when like anything, issues, bowel, whether that's constipation, IBS, or also pain with sex and anything that goes along with that, as well as like core strengthening is a big thing that we work on. So the biggest, our main target population is that we work with women before, during, and after pregnancy. And a lot of, one of the questions that I was asked is, what are common challenges that happen to women in the postpartum period? And there's a few big things. One of them is diastasis recti, which is a separation of the abs, but kind of as a more general thing, is a lot of just like core weakness. You go to pick up your baby and you just don't feel strong in your stomach. And sometimes that can be related to, I don't feel good here, and so now I'm having this back pain, or now I'm having this hip pain. That's a big thing that we see. Sometimes it's, oh my gosh, I'm leaking. My mom does this. She's done it for years. And she says it's just because she had babies, but I don't want to be like that. Like, I don't want to be peeing my pants for forever. And definitely like something that you don't have to have forever. It's common, but it's, not just your norm because you had a baby. Other things that we see a lot are like neck and shoulder pain from nursing. So a lot of time spent like looking down at baby. So we're really big on posture, kind of how, like, teaching you how to use the muscles the right way so that these ones aren't like super tense all the time. And then also sometimes there can be pain with intercourse after having a baby. That's another thing that some people think like, oh, well, I had a baby, but really it's not something that needs to persist after having a child. So that's another thing that we work on with women. So who I am, I went to the University of Iowa for PT school. I'm from Eastern Iowa in Cedar Rapids area. And then I moved here, got this job, and I've been here for about a year. And my background is in women's health, and I've taken some training for dry needling as well as medical therapeutic yoga. So a lot of us have that similar kind of scope of things, but I really love incorporating yoga and treatment. I love doing it outside of work, but I also love using it to help women here. All right, so now we're going to talk about the anatomy of the pelvis and the pelvic floor. So these are your hip bones. Like when you put your hands on your hips, this is where they are. This is the front, so this is the pubic symphysis, which sometimes at the end of pregnancy, this area can get super sore. And then this in the back, this is the spine, and then that sacrum kind of tailbone area down at the bottom. So this is your low back, hip bones, and then at the front is the pubic bone. These are your sits bones. So when you sit on bleachers and you feel that kind of sore spot after a while, that's down here. So then taking a look inside, that is our pelvic floor. So all the stuff that's red, that's all muscle. We have a few muscles in through here that are mainly hip muscles, so that kind of shows how closely hips and pelvic floor are related. A lot of the times when we have someone come in and they're maybe leaking or having pelvic pain, sometimes there's also a low back issue or a hip issue, and kind of this visual helps see how interrelated those areas are. So taking a look at the pelvic floor again, there's 3 holes here in a row, and so the back is the anus, and then vagina, and then urethra. So where poop comes out, where babies come out, and then where pee comes out. All of these are really affected by anything that affects the pelvic floor because they're all in there. And so let's talk about what a Kegel is. So some of you might have done them before, some of you have never done them, someone told you to do them when you were pregnant, but you didn't really know what they were. But a Kegel is a pelvic floor contraction. So if this is like someone sitting, this pelvis is sitting, when we contract those pelvic floor muscles, what happens is that there's a squeeze around all 3 holes, but also a lift up and into the body. So they squeeze and then lift up. A lot of times we talk about this elevator analogy of pelvic floor. So if we're kind of resting at ground level, a contraction is going up to level 4 or 5. And then when you go to have a bowel movement or push a baby out, that's going down to the basement. So we've got a few different movements of pelvic floor. We have the contraction, which is a Kegel, relaxation, which is letting go of that Kegel and going back to resting level, and then bearing down, which is pushing out and lengthening those muscles to have a baby or to have a BM. So let's talk about, we kind of touched on this, but there are 3 main categories of pelvic floor problems. And these are all things that we treat here, all things that we see a lot of the time and that there's help for. So the thing about pelvic floor problems is that sometimes they're embarrassing to talk about, and so you don't tell anyone and you don't know that there's a solution for these things. So 3 things that we see a lot, again, just to recap, so anything having to do with bowel, whether that's constipation, leaking, bowel leakage, and just feeling weak in that area, or like rectal pain. And then anything having to do with the vagina, so pain with sex, whether that's like deep or more superficial, and like not being able to wear a tampon, stuff like that. And then things with the urethra, so that can be leaking or having difficulty urinating or having strange sensations with urination. And then, so something that I like to mention about leaking, urinary leaking specifically, is that it is not always due to weak pelvic floor muscles. So a lot of the time, the pelvic floor in women can be a place where we hold stress, and the pelvic floor, instead of resting at the nice like ground level, can just be resting at level 4. And so sometimes that is where we can get leaking, which seems counterintuitive. Like if those muscles are tense, like why aren't they holding the pee in there? But it's kind of like if I was carrying around a heavy tote bag all day, and then once I finally set it down, someone threw me a ball and said, "Hey, catch." There's no strength left. So that's kind of the analogy that I like to give in regards to pelvic floor tension relating to leaking, is that there's kind of 2 different sides. You can be weak or you can be holding too much tension in your pelvic floor, and both of those can lead to leaking. So it's not that everyone who leaks needs to do Kegels. That's basically the bottom line there, is that just because you're having urinary leaking doesn't mean you need to go and do a bunch of Kegels. And that's part of why seeing a pelvic floor PT for urinary leaking is important, because we can help you determine kind of where you're at on that spectrum, and then what are the steps that you need to take in order to not leak anymore. Okay. So now what we're going to go through is we are going to go through our breath pattern that we use. So we do breathing into the tummy and abdominal breathing. So if you've ever done like belly breathing before, or diaphragmatic breathing, it's kind of like that. It's a little different though. And we're gonna use that to add a pelvic floor contraction in. And then we will talk about also how to relax the pelvic floor and what that looks like, because a lot of times, we're teaching people how to contract, but a lot of what we do here is also teaching people how to relax their pelvic floor, which can be just as hard, if not harder. All right, so you're just gonna start by breathing into your tummy, and exhale, let it go, and picture the breath going not just into the front of your tummy, but also all the way around your belly and into your low back. So once you feel like you've got that and you're sending your air there, on the next breath, think about sending it deeper. So visualize this pelvic floor here, and that as you send your air to your tummy, you're also sending it all the way down to these muscles in your pelvis. Deep breath in, and exhale, letting it go. Breathing into your tummy, breathing into your pelvis, and letting it go on each exhale. So now what we're gonna do is, on the exhale of this next breath, add a 20% effort Kegel. So not the strongest Kegel that you could ever do, but just a gentle one, just a small Kegel. So breathing into your tummy, and then exhale, 20% Kegel. Feel those muscles squeeze and lift up and into the body. And then as you breathe in, let that Kegel go, let your tummy go. And then exhale, 20% squeeze and lift up and in. And try a few rounds of breath just like that. So inhale, pelvic floor relaxes. Exhale, 20% lift up and in. Breathing in, totally letting that go. Exhale, 20% lift up and in. And trying to hold that Kegel throughout the exhale. Breath in, letting it go. Feeling pelvic floor lengthen more towards that level 1, that ground level. And then as you exhale, 20% lift up and in. So sometimes a thing that happens a lot is that women have a hard time feeling, I don't know if I relaxed my pelvic floor, or I was thinking about relaxing, but I couldn't feel anything, so I'm not sure if I'm doing it right. So that is super common. It gets better in time. It's something that we work on here a lot. But things that you can visualize to help are, so with pelvic floor relaxation and a lot of things pelvic floor, a lot of it is like visualize this or think about this and figuring out what cue works best for your body. So some good ones to start with as far as relaxation are picturing that elevator, picturing pelvic floor lengthening down as you breathe in. So breathing in and picturing lengthening. Exhale, 20% squeeze and lift. Breathing in, elevator lengthening down to the bottom. Exhale, 20% squeeze and lift. Another cue that we use a lot for pelvic floor relaxation is picture the vagina as a circle getting larger on your inhale. So relaxation is always with the inhales, and exhale is always with the Kegels. We have a term that we use a lot called exhale with effort, and whether that be like exhale as you lift up your kids, and we use it in a lot of different ways, but it can help you remember how this breath pattern goes. So it's breathing in and relaxing, and then exhale with effort as you 20% squeeze and lift up and in, and then breathing in, picturing those muscles lengthening down. Exhale, 20% squeeze up and in. So that breath is how we start, and a lot of people learning how to connect better to their pelvic floor, work on core coordination, and a lot of times that will be like a first step that we use here to start building up strength and start, because it's not just about strength, but it's also about the brain-body connection. So that's a big way that we work on that here. Let's see. Another thing that I wanted to show you guys is a stretch that's really great for after nursing. So the front of the chest gets super tight. So there's two ways to do this stretch. I'm gonna grab the foam roller. So if you have a long foam roller, that is my favorite way to do this stretch, because you can let gravity do a little bit more of the work and it feels a little more relaxing here. So what you're gonna do is get all the way laying down on your foam roller with your butt supported and your head supported. And then you're gonna take your arms out into a W. And so this is a really great place to rest. Your arms don't have to touch the ground. They might at some point, but if you're tight, they might not. And so kind of using your feet wider apart here to help you get balance. But then from this position, you can take a break and do a T. So going back and forth between the T and the W is a great way to get this stretch. If you don't have a foam roller like this, or you don't have one that's long, another way that you can do this stretch is in a corner. So I will show you that. And then do a gentle lunge forward. So usually you don't need a ton of lunge forward to feel a stretch here. And you can play around with the angle. So I usually start like straight out from my shoulders and then gradually work your way up. So that's a pec stretch, a really nice thing for after nursing, or after if you've had a day or week or month where you've had a baby that really wants to be held. That's a nice thing to do too. All right. So now 2 more exercises that I'm going to show you guys. So the reason why I picked these exercises was because they are great for new moms. Targeting some things that we see a lot come up in new moms, areas of weakness or areas that people want to work on, or that are related to stuff that just gets weaker during pregnancy. So this next one is going to be a hip strengthener. All right, so this is called a clamshell. And so what you're gonna do is you're gonna lay on your side, and then you want your hips to be stacked here. So not open like this, but nice and stacked. And then all you're gonna do is lift that knee up towards the ceiling. And so I encourage you guys to try this. It's harder than it looks. And where you should feel this is on the outside of the back of your butt. So you don't want to feel it on the front. If you do, you might want to check that your shoulders are stacked and that your hips are stacked. And so pretty simple, lifting the knee up and then slowly lowering it, and then checking back that you're not rocking open as you do this. So you want to stay nice and steady as you really lift all the way up and then down. That last extra inch can be the matter of whether you feel the burn or not. So make sure you really go for it with this one. And then do this one on both sides. So this is a good one to do like 2 rounds of 12 can be a good place to start. All right. So last one that we'll go through is a core strengthener. And so with this one, we're going to use that same breath pattern that we started earlier, but we're going to incorporate a little more core action. So what we're going to do here is start with that breath. So start by taking a breath into your tummy, and then that exhale, 20% Kegel. Breathing into the tummy, 20% Kegel. And then what I want you to try is breathe in again, let all of that go, and then exhale, Kegel, and then lift one leg up to a marching position and set it back down. Breathe in, let your pelvic floor let go. Exhale, 20% drawing up and in, and march that leg up, and then set it back down. So it's a lot of moving pieces here, but this way we are using pelvic floor to tap into our deep core muscles and using those to do this movement. So coordination, pelvic floor, and core work all in one. Breathing in, exhale, 20% Kegel, march up and down, and that all is happening on the exhale as you hold that pelvic floor contraction. Inhale, exhale, Kegel, march up and down. Inhale, letting pelvic floor relax. Exhale, Kegel, march up and back down. And try a few rounds of this. Breathing in, exhale, Kegel, march up and down. Inhale, exhale, Kegel, march up and down. Breath in, exhale, Kegel, march up and down. So that is one to start with, a great beginning core exercise. And I say beginning, but it still feels really hard. So just because it's a beginning exercise doesn't mean it's easy. All right, so if any of those exercises that we did or anything that we talked about with pelvic floor contraction were difficult or hard, know that that's very common and that's something that we can help you with. So something new and awesome that we're able to do in the past few weeks is that we have the opportunity to do telehealth visits. So we can still see you and talk through everything, but it's through the computer if you want to stay at home. And get started on things and get started making progress towards your goals, whether that be not peeing your pants or not having pelvic pain or not having your hip hurt when you run, or a whole spectrum of things, feeling stronger when you pick up your kids. So you can look us up online. It's Breathe, BREATHEDSM.com. And then you can find out more about us there and how to contact us. But also on Instagram and Facebook, we share a lot of videos with tips like this, or tips on how to hold your baby, and sometimes like a new stretch that might feel really good. So check us out there and you'll find more helpful things. We like to give all the information out to help. We say we want to help all the women with all of the things. So check that out. And then we also have a new online membership program where you can find videos that get really specific on how to do a Kegel, how to relax your pelvic floor, and then how to do that first core exercise, but then progress through that. So that's called Breathe at Home, and that's our online membership that has tons of videos added every week to help with a lot of these same things. So that is also something you can find on our website. But yes, let Carmen know if you have any questions for me, and I can kind of type up a response to questions, and then that can get emailed out to you guys. But it was nice speaking with you, and I hope you have a great day.